Now to the latest on COVID. Hundreds of out-of-state healthcare professionals are heading to Oregon to help with the surge in hospital COVID cases. Some may arrive as soon as this weekend. Pat Doris explains.
At St. Charles Medical Center in Bend, help from outside the state cannot arrive too soon. The hospital has job openings for many nurses who are badly needed. Dr. Doug Merrill, the System Chief Medical Officer for St. Charles, told me last week in Bend that it's difficult to hire nurses right now.
We have 161, I think, nursing positions open and unfilled right now at this hospital. Right.
The lack of workers means those who are here work longer and more frequently, and sometimes hospital beds are simply not available because there's no one to take care of the patient who would be put in that bed. But that may soon change, at least in the short term. The state of Oregon hired 2 companies to supply nurses and others for Central and Southern Oregon hospitals and long-term care facilities. Dan Dietrich is president of Jogan Health Solutions, which is sending up to 500 people. How long is it going to take these teams to get here?
Yeah, so we move really fast, and we will have them in place within a few days.
Really?
Yes.
So, like by the weekend?
That's
maybe.
what we specialize in, rapid deployment in response to these types of emergencies.
He said his teams are made up of professionals from outside Oregon, so it's not taking from the very areas which need help. Hospitals began asking the state for extra staffing 2 weeks ago, according to the OHA. St. Charles Bend and St. Charles Redmond have asked for a total of 58 acute care nurses, 76 critical care nurses, 9 emergency department nurses, 5 respiratory therapists, and 46 certified nursing assistants. The system CEO said he's relieved to hear that help is on the way. The chief financial officer for the Oregon Health Authority said Oregon has already done work with Jogan Health Solutions, but this contract will be much bigger than before.
We had already done some work and so had a contract in place that we amended. It's for a lot more than what we originally had originally set up with them. It was $1 million contract. And now, as you saw, it's $100 million.
So that will be a big jump. The other company involved is called AMN Healthcare. They're providing 60 additional nurses and clinical workers. Back to you.
All right, Pat, how long will they be there?
Well, that is an interesting question. The state has set up kind of a crisis management overhead team for these things. And so they'll be in charge of looking at where people are needed. So there might be a bunch in Bend for a while. And then if it turns out, for example, that Grants Pass needs more, the oversight team will be able to shift them down there. So in the short term, there could be some movement around. For the long term, the contract is for 4 months or basically through the end of the year. Back to you.
All right, some much needed help. Pat, thank you for that report.